Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to demonstrate for you on a patient how to auscultate the lungs anteriorly and posteriorly. In the previous video I went over an in-depth lecture about how to do this along with normal breath sounds and abnormal breath sounds. So be sure to check out that video after you watch this. So let's get started. First I want to start out showing you the auscultation sites. I wanted to use these stickers so you can see about where I'm going to go with the stethoscope. And let me go over these real fast for you because these are the little landmarks of where you're going. We have our right lung over here and our left lung over here. And what we're doing is we're assessing the lungs. The right lung has 3 lobes, the right upper, the right middle, and the right lower. The left lung only has 2 lobes, the left upper and the left lower. So whenever you're listening, you want to start out at your apex up at the top of the lungs, right above the clavicle, just slightly above it, right here where you see these pink stickers. Then you're going to go down to the second intercostal space, a little bit over from where your breastbone is, the sternum. And this is where you're going to start assessing the upper lobes of the lung. Then you're just going to inch down a little bit and this is about the 3rd intercostal space, and you're going to listen here. Then go down to the 4th intercostal space. And this is one of the landmarks for the right middle lobe, your 4th intercostal space. So right here, we'll listen over here, our right middle lobe, and then we'll listen to our left upper lobe. Then we'll inch down a little bit and we'll listen a little bit more to that right middle lobe, and then we're going to be listening to our left lobe, and then we're going to go mid-axillary over here to the side where the armpit is, mid-axillary 6th intercostal space, and we're going to be assessing our lower lobe. So it's right here on him, and then it's again right here. And you'll listen there, and then you'll just inch down a little bit and listen at the bottom just to assess those lower lobes a little bit. Now let's listen to the lungs with a stethoscope. Okay, before you begin, what you want to do is you want to perform hand hygiene, introduce yourself to the patient, and tell them what you're going to be doing. And whenever I listen to lung sounds, I like to listen directly on the skin with my stethoscope, not over the gown or over their clothing, because you can pick up other sounds that may sound adventitious when it's really not, and you just get the best acoustic sound whenever you listen directly on the patient. So you want to get your stethoscope and you want to listen with the diaphragm of your stethoscope because that's what picks up the best sounds. And what we're listening for is that full cycle of inspiration and expiration. And we're paying attention to what type of breath sound is it? Is it bronchial, vesicular, bronchovesicular? If you're not familiar with those sounds, check out my other videos because I have audio clips where you can listen to those. And we're also listening for any extra sounds on top of those sounds, like crackles, wheezes, stridor, anything like that we may be picking up. And another key is this skill takes getting used to. You have to practice it over and over, especially when you're listening over these areas because you're going to hear the heartbeat at the same time. So you got to train your ears to listen for those correct sounds like the heart versus lung. So practice this on yourself and on others so you can get comfortable with it. So what we're going to do is we're going to start at the top and we're going to work our way down. And we're going to start on one side and then compare that side because we want to see if we're hearing the same thing on this side as we are that side. So let's get started. Okay, what I'm going to have you do is take one breath in through your mouth and out through your mouth. And if you start to get dizzy or anything, let me know and we can slow down, okay? We're starting up at the apex, right above the clavicle. Now we're going to inch down to the 2nd intercostal space, and this is where we're going to start listening to our upper lobes of our lungs. So it's about right there. Then we're just going to inch down a little bit to about the 3rd intercostal space and listen there. And we're going to go over and compare it. Now we're going to go down to the 4th intercostal space, and we're still going to be in the upper lobe of the left lung, but now we're going to be in the middle lobe of the right lung. So let's just go down just a little bit. And then we're going to go over here and compare. And then we'll just go a little bit down, maybe the 5th intercostal space, just still assessing that middle lobe. Going to go over here and compare. Now we're going to go mid-axillary, and we're going to be down in our lower lobes now. And this will be at the 6th intercostal space. Okay, we're going to compare sides. So if you just want to turn over here, we're going to go mid-axillary, compare side. Then we're just going to go down just a little bit to stay in that lower lobe. And then we're going to compare sides. Now let's look at the posterior view of the back. Here, over on this side, we have the left lung, and over here we have the right lung. It's flipped compared to the anterior view. And what we'll do is we'll start listening up at the apex of the lungs again, and that's right above, slightly above that shoulder blade in this area where the green stickers are. Then we're going to go and we're going to listen between C7 to T3. And C7 is where your prominence starts, so right here, and we'll go a little bit below it because C7 to T3 is going to assess the upper lobes of the posterior side of the lungs. So we'll go here and here, then we'll go down just a little bit. This is about where T3 is. And then we'll jump down to around T4. And from T3 to T10, we'll be assessing the lower lobes. In your posterior view, you have more ability to auscultate the lower lobes than compared to the anterior view where you're going to really be assessing the upper lobes. So then we'll just go down, listen here, listen there, and we'll go there, and then we'll just go a little bit mid-axillary, almost mid-axillary, and listen over on these sides, and then down at the bottom and over here. Now let's do it with a stethoscope. Now we're going to listen posteriorly. Okay, let me tell you a trick with this. Whenever you're listening back here, as you've learned if you watch the other lectures, you have the scapula back here and you have the vertebrae. And what you're trying to do is to get in between that scapula and vertebrae to listen to those lungs. And you don't want to go over the shoulder blades of scapula while you're listening to lungs because it's really going to muffle out your sound and you're not going to hear a lot. So what you need to do is have the patient sort of just move their arms like this to separate those shoulder blades from one another so you have some space to work with. So what we're going to do again, we're going to start from top and work our way to the bottom, and we're going to compare sides. So we're going to go slightly above the scapula and listen to the apex. Then we're going to go down in the area where C7 is, which is where your prominence is. Then we'll work our way down to where T3, and remember this is assessing the upper lobes, and then we'll go down from T3 to about T10 and assess those lower lobes. So here we go. And again, just take good deep breaths for me in and out. Okay, and we are done with posterior. Okay, so that is how you assess the lungs with a stethoscope. Now be sure to check out the other videos in this lung series, like the audio files of the normal breath sounds versus abnormal, and the lecture that covers this material in depth. And thank you so much for watching, and please consider subscribing to this YouTube channel.